Hi, I'm Naomi, one of the resilience workers at The Corner, Sheffield Young People's Substance Misuse Service, part of Change Grow Live. This presentation is aimed at professionals and gives a basic introduction to cannabis awareness. Today we're going to have a look at some information on what is cannabis, some of the myths and truths surrounding cannabis, the two main psychoactive chemicals in cannabis and what their functions are, and we'll also have a look at cannabis and mental health. So what is cannabis? Cannabis has been around for thousands and thousands of years, and it's known by a wide variety of names, including bud, weed, marijuana, dope, ganja, pot, piff, puff, Mary J, wacky backy. The list is endless, it goes on and on. There are probably over 1,000 names for cannabis, and some of these come from a specific strain of cannabis that is crossbred to produce a particular style of high, a particular level of THC and CBD content, and these often become street names also. Cannabis comes in a variety of forms as well, so most common that we would know is bud. So this is the flowering part of the plant, and it can be crushed up and put into a joint or put into cooking as well to release the effects of the cannabis. Another form is weed, so this is the leaf part of the plant. Again, that can be crushed up, dried and sprinkled into joints and again into cooking. Hashish isn't as common as it used to be. It was around a lot more in the 70s and the 80s. Now this is the part of the plant that has been made from the resin, so it can come as a black colour, brown colour, it can be soft, it can be hard. It really depends on the processing. But the important thing about hashish is because it comes in this variety of colours and forms, adulterants can be put in there to bulk out the weight. These can be things like plastic or other harmful substances. There's oil, not common within cannabis, but it does come under another form of cannabis as well that we're starting to see an emerging trend with, which is DAFs. Now these are commonly referred to as shatter or butter or oil, and they range in potency levels. They are very potent, they're highly concentrated forms of cannabis. You do tend to need specialist equipment to use these, but it's an emerging trend that we're starting to see come through on the streets. Cannabis can be smoked, vaped or eaten. It's usually smoked in spliffs and bongs. It can be vaped using special vaporizing masks or through e-cigarettes and e-juicers. It's important to notice that with the e-juicers, although they say THC, they often contain synthetic cannabinoids such as spice, and people can have a really bad experience on this. It's also important to note that when people are cooking it and eating it, that it actually takes longer to feel the effects that it would do smoking or vaping. And this can be of particular concern when a young person switches from smoking to eating cannabis. They're expecting to feel the effects almost instantaneously as they would do with smoking, but it actually takes around an hour, even possibly 2 hours, to feel the effects when eating. So the danger there is that the young person feels that the cannabis is no good, it's not as strong, and they eat some more. And once it's in their system, the only thing that's going to take that out again is time. And eating cannabis, the effects take longer to wear off, up to 8 hours, potentially even 12. So that's an important thing to think about if somebody is eating cannabis. Cannabis is a Class B drug which carries a maximum penalty of imprisonment for up to 5 years for possession and 14 years for supply. Both of these also carry an unlimited fine. The law around cannabis is a little bit complicated, so this has been dealt with in a separate presentation called Cannabis and the Law. Please do check out if you're interested around the legal aspects of cannabis possession and supply. Cannabis has both depressant qualities and hallucinogenic properties. So when we're talking about depressant, we do not mean it makes you feel depressed. We mean it slows down the body's automatic functions, such as the heart rate, body temperature, digestion and breathing rate. When we're talking about hallucinogenic properties, it alters the way in which we interpret the world. So this can be through sight, through sound, through touch, through smell and through taste. So when we think about cannabis and people getting the munchies or food tasting better when they've been taking cannabis, this alludes to the hallucinogenic properties of the drug. Now we're going to have a look at some common myths and truths surrounding cannabis. If you're watching with friends or with colleagues, please pause the video, have a discussion, see what you think, see what the common consensus is around these common myths and truths. Cannabis is a natural plant, so it can't be bad. Do you think that's a myth or a truth? It's a myth. So although it is a natural plant, we have to think of what other drugs we derive from plants. And think about it, there's cocaine, that comes from the coca plant, there's heroin, that's from the poppy plant, and there's tobacco from the tobacco plant. And if you think about how many chemicals are in tobacco and that consist naturally, I mean, tobacco is a natural insecticide, so it has those properties in it already. And cannabis is no different. It does contain chemicals, some of which are harmful to our bodies. You can get cannabis prescribed by a doctor. Do you think that's a myth or a truth? It is a truth. So cannabis can only be prescribed in the UK since 2019 by a specialist doctor, where all other traditional therapies have failed. And it can only be prescribed for epilepsy, multiple sclerosis, and cancer patients receiving chemotherapy. It's also important to note that this is a medicine that's prescribed. You can't go out and buy street cannabis and smoke that. It is a prescription and it is a medicine. Cannabis can cure cancer. Do you think that's a myth or a truth? It is a myth. As I mentioned, cannabis can be prescribed to cancer patients to help them when receiving chemotherapy, as it reduces some of the nasty side effects of chemotherapy treatment, like feeling sick and not being able to eat. We know cannabis gives people the munchies, so it can help people eat. It can help with that feeling of sickness. But cannabis itself contains a lot of chemicals, and there are 40 of those that we know, at least 40, that can cause cancer. Anything that we put into our lungs when cannabis is smoking is also going to damage our lungs. And damaging our lungs obviously can lead to nasty chest infections, bronchitis, and things like lung cancer. Common question asked by young people: you can't get addicted to cannabis. Is that a myth or a truth? It is a myth, but it's important to recognise that there are two types of addiction when we're talking about somebody becoming dependent and needing that substance. There is the physical dependency. So this is when the body becomes unwell if it does not have the drug. So if we're thinking about a lot of depressants fall in this category actually. So things like heroin, things like alcohol. If the body does not have that drug at the level of dependency, it will become unwell and have negative side effects when stopping taking the drug. There is also a psychological addiction. So this is more that kind of wanting. Our brains cannot think of anything else other than getting that drug. We feel cravings every time we see something that reminds us of using a substance. We want to go ahead and use it. So this is much more of the mind, but just as difficult to deal with when we talk about addiction. Cannabis can be both. There's a lot of evidence around the psychological addiction of cannabis, but we're now starting to see with some of the stronger strains of cannabis that it is becoming physically addictive also. This is also a common question asked by parents and professionals. Cannabis is getting stronger. Do you think that's a myth or a truth? So this is a truth for the book. Cannabis has been becoming stronger over the years, and this is down to two main chemicals in cannabis. Do you know what these are? Most people will recognise at least one of these, as it's sold widely in high street stores at the moment. That's CBD. The other being THC. We're going to have a little look about why cannabis is becoming stronger, but might I also point you out to another presentation done by a colleague of mine. So what is skunk? You may have heard that term skunk as to referring to high strength cannabis, but it's a lot more complicated than that. Now we'll have a look at these two in more detail. So THC, tetrahydrocannabinol, to give it its full scientific name. This is the bit that gives people the munchies, it gives people the giggles, relaxation, that chilled feeling. People say that it helps them to release stress and that anxiety dampening of smoking cannabis. And they also say it helps them socialise, much in the same way that some people say having a drink of alcohol helps them socialise. So these are the positive things from THC that most people who use cannabis would like to experience at least one or all of these characteristics. But there are negatives that come with THC as well. So we're looking at anxiety. A bit of an oxymoron, it relieves stress but can increase anxiety. So that is dependent very much on the individual and what they've got going on in their life at that time or previous anxiety history. It can induce panic attacks, that feeling of being unable to breathe, that feeling of the world's closing in on you and feeling really panicked and really anxious. Paranoia is a big one that we talk about with cannabis and young people. So that feeling that everybody's watching you, that the world can tell that you're stoned, that people are following you, it can increase paranoia. And at the extreme end of mental health issues, it can also induce psychosis. So this is the inability of being able to distinguish what is real and what isn't. And if we think about the hallucinogenic effects, that makes sense. CBD, cannabinol, bought in many high street stores, but what does it do? So it's the natural antipsychotic agent of cannabis, so it can protect against those negative effects of THC. So it's reducing all of those negative effects. We're feeling a lot more calm, getting a much nicer high from the cannabis. So this leads us on to why cannabis is getting stronger. THC is the chemical that gets people high. That is what people are after when they are using cannabis, that feeling of being high. And different strains of cannabis are now being crossbred to make strains of cannabis with higher levels of THC. So it's almost like a genetic modification of cannabis. About 40 years ago, the average THC level in cannabis was around 8 to 12%, but now we're looking more at 14 to 25% levels of THC in cannabis, which is producing that higher high. But CBD has been neglected. It's not been matched when raising the levels of THC. So that natural protection element that we have in cannabis is being reduced. So the THC is having more of an impact. So what does this all mean for mental health? Well, as we mentioned before, CBD is the natural protector against the negative effects of THC. So as that's being kept at the same level or reduced, the THC negative elements are becoming more to the forefront. So anxiety, panic attacks, paranoia, psychosis, we're seeing more and more of these occurrences linked with cannabis use. So important things to remember about cannabis and mental health. We mentioned about CBD and THC. It is impossible to separate the two. So the CBD products that are being sold in high street shops will have some level of THC in them. The legal limit is 0.2% THC content. Now there's no governing body regulating this, so it could be that somebody selling a legitimate CBD oil may actually be breaking the law if the levels go above that. And again, we mentioned if THC has the negative mental health effect, then it can also lead to complications if somebody's expecting to use a CBD product which has levels of THC in them. That said, there is no confirmed evidence that cannabis causes mental health problems, but it can trigger them in people that are susceptible to developing mental health problems. So we call this predisposing factors. So it might be that they have a history of mental health themselves, they have a history of trauma, that their family has a history of mental health problems. So it's really important to explain that to young people, that if there's any vulnerability factors, that could then trigger a mental health factor in themselves by smoking cannabis. And we talk about cannabis interrupting normal brain development. So normal brain development is what we'd expect to see right up until the age of 18, 21. Some experts even say our brains still develop until we're 30. So interrupting the developmental stages could lead to deficits that could leave somebody vulnerable to developing mental health issues if smoking cannabis at a young age. As I've just said, the younger someone starts smoking cannabis, the more likely they're developing mental health problems. It's a greater risk. So hopefully today's session has raised your awareness on cannabis being a Class B drug with both depressant and hallucinogenic properties, that there are many myths circulating about cannabis, and it's always recommended to use a reputable source for your information. So places like the Corner website has fantastic information, and also places like Talk to Frank. THC is the chemical that gives us the feeling of being high, but it also gives some of the negative effects that we associate with cannabis, and CBD is the natural remedy. There are links between mental health and cannabis use, but these are not cause and effect. This session has been brought to you by The Corner, Sheffield Young People's Substance Misuse Service, part of Change Grow Live. Our contact details are on the screen now, including our social media accounts. Please give us a like or a follow, or feel free to ask us any questions or leave any comments. Thank you very much for listening.